Welcome back.
In this video we will talk about the unbearable pain. So much so that you won't even want to get off the bed. You probably know more than one person with this condition as it's relatively common, with a lifetime incidence of 10 to 40%. Yes. You guessed it right, I'm talking about sciatica. Before we talk on the sciatica, let's talk about sciatic nerve. Sciatic nerve is a combination of 5 nerve roots that exit from inside the lower lumbar and upper sacral spine, i.e., L4, L5, S1, S2, and S3. These 5 nerves group together deep in the buttock, near the front surface of the piriformis muscle, and combine to form the single large, thick nerve, nothing but sciatic nerve. In your lower back, this sciatic nerve and also few other surrounding nerves and blood vessels comes out through an opening called the greater sciatic foramen, or also called as sciatic notch. This opening is located deep in the buttock, just below the piriformis muscle. The reason for sciatica lies in sciatic nerve origin, passage and its location. As it originates deep in buttock and comes out from between the larger muscle group and rest on ischium bone. All of this area, actually we use for sitting, sciatic nerve can be affected at its root point or on anywhere on its body. When it is affected at root point it is called as lumbar radiculopathy and is commonly referred to as sciatica. And when it is affected anywhere on its body, then it is called as sciatic neuropathy. Usually, sciatica affects only one leg at a time and the symptoms radiate from the lower back or buttock to the thigh and down the leg. Sciatica may cause pain in the front, back, and/or sides of the thigh and leg. A few common symptoms seen in sciatica are pain. Sciatica pain may be constant or intermittent. The pain is usually described as a burning sensation or a sharp, shooting pain. Altered sensation, numbness, tingling, and/or a pins and needles sensation. Weakness. Weakness may be felt in the leg and foot. Change in posture may aggravate or relieve pain. Depending on the duration of symptoms and if one or both legs are affected, sciatica can be of different types. Acute sciatica. Acute sciatica is a recent onset, 4 to 8 week duration of sciatic nerve pain. The pain may be self-managed and may not typically require medical treatment. Chronic sciatica. Chronic sciatica is persistent sciatic nerve pain that lasts for more than 8 weeks and usually does not subside with self-management. Depending on the cause, chronic sciatica may require non-surgical or surgical treatment. Alternating sciatica. Alternating sciatica is sciatic nerve pain that affects both legs alternately. This type of sciatica is rare and may result from degenerative problems in the sacroiliac joint. Bilateral sciatica. Bilateral sciatica occurs in both legs together. This type of sciatica is rare and may occur due to degenerative changes in the vertebrae and/or the disc at several spinal levels, or from serious conditions such as cauda equina syndrome. What causes sciatica? Sciatica can be caused by several conditions. It can be by an injury, or spinal or sciatic nerve tumors. Common conditions that can cause sciatica are healthy disc. Herniated disc. The soft part of the vertebrae bulges out due to the rupture of cartilage and compress your sciatic nerve, resulting in lower limb pain and numbness. Healthy spine. Spinal stenosis. It's characterized by the abnormal narrowing of your lower spinal canal. This narrowing put pressure on your spinal cord and your sciatic nerve roots. Healthy spine. Spondylolisthesis. It is one of the associated conditions of degenerative disc disorder. When one spinal bone, or vertebra, extends forward over another, the extended spinal bone can pinch nerves that make up your sciatic nerve. Piriformis syndrome. It is a rare neuromuscular disorder in which your piriformis muscle involuntarily contracts or tightens, causing sciatica. How is sciatica different from lower back pain? In sciatica, the pain radiates from the lower back into the leg. Whereas in lower back pain, LBP, discomfort remains in the lower back only. There are many other conditions with symptoms similar to sciatica. These include 1. Bursitis. 2. Herniated disc. 3. Pinched nerve. Okay, when to seek medical attention? If your symptoms aren't improving with self-care, if the flare-up has lasted longer than a week, if the pain is more severe than it has been with previous flare-ups or is gradually worsening, or if the pain has occurred immediately following a traumatic injury, such as a car accident, or if you're having trouble controlling your bladder or bowels. Physical therapy treatment. 1. Cold packs and hot packs. It's recommended that you use ice or cold packs during the first couple of days to reduce swelling. After 2 or 3 days, switch to hot packs, as heat can help relax muscles in the back, which can spasm when an injury occurs. If you continue to have pain, try alternating between ice and heat therapy. 2. Here are a few exercises that you should do to get some relief from sciatica. Before we begin with exercises, here are some of the important instructions to follow while doing exercises. Important instructions to follow while doing exercises. 1. Be mindful of taking deep breath in and pursed-lipped breath out while exercising. 2. Be mindful of your moves, use mirror in front you to judge on your moves. 3. Exercises demonstrated in the video are done by professionals, you may not get exact stretch, don't worry, it will come slowly. 4. Don't push harder, or do any jerky movements, do it slowly and let gravity do the work, and if you feel pain, don't push it beyond. 1. Seated glute stretch. Do it as shown in video. Do good leaning on thigh and hold the position for 15 to 30 seconds. This stretches the glutes and lower back. Do 5 to 7 reps on one side and repeat on the other side to complete one set. 2. Sitting spinal stretch. Do it as shown in video. Do good stretching, after turning your torso, hold it for 15 to 30 seconds. Do 3 to 5 reps on one side and repeat on the other side to complete one set. 3. Basic seated stretch. Do it as shown in video. Bend forward with your chest and try to hold your spine straight. As long as it's not painful, try to bend over a bit more. Stop if you feel any pain, hold it for 10 to 15 seconds. Do 5 to 7 reps on one side and repeat on the other side to complete one set. 4. Figure 4 stretch. Do it as shown in video. After moving your legs up toward the torso, hold the position for 10 to 15 seconds. Do 5 to 7 reps on one side and repeat on the other side to complete one set. 5. Knee to the opposite shoulder. Do it as shown in video. Pull your right leg across your body toward your left shoulder and press a bit. If you don't feel any pain, hold the position for 15 to 30 seconds. Do 3 to 5 reps on one side and then repeat on the other side to complete one set. 6. Standing hamstring stretch. Do it as shown in video. Bend your body forward slightly toward your foot to get little deeper the stretch. If you don't feel pain, hold the position for 15 to 30 seconds. Do 5 to 7 reps on one side and then repeat on the other side to complete one set. 7. Standing piriformis stretch. Do it as shown in video. If your balance is good, you can do this, if not, avoid this. Bend your leg to figure of 4 and lower your hips to the ground at a 45-degree angle. Hold the position for 20 to 30 seconds. Do 3 to 5 reps on one side and then repeat on the other side to complete one set. 8. Scissor hamstring stretch. Do it as shown in video. Keep right foot about 3 feet behind your left foot, pull your hips forward and push your shoulders back. You may use a chair for balancing if you need it. Hold the position for 10 to 15 seconds. Do 3 to 5 reps on one side and then repeat on the other side to complete one set. 9. Forward pigeon pose. Do it as shown in video. Stretch the left leg out all the way behind you on the floor, shift your body weight gradually from your arms to your legs, hold the position for 5 to 10 seconds. Do 3 to 5 reps on one side and then repeat on the other side to complete one set. Any questions, write to me in comment section.